Hi everybody, welcome back to UWorld's Next Gen NCLEX review session. My name is Jackie and I'm a nurse here at UWorld. We're so glad to have you guys with us today. We are doing neurology questions, so if you are new to these question drill sets, what you can expect is we'll pull up a question, read it to you guys, give you about 30 seconds to answer, and then we'll walk through why the correct answer is right. We try and keep a quick cadence on these, get through as many questions as possible. As we go along, make sure you're using that chat. We have Nurse Samantha moderating the chat for us today, so be sure and say hello to her and let us know where you guys are joining us from. We are here in Dallas and it is freezing today, so we hope you guys are staying warm indoors, and we're glad to have you guys with us. Let's go ahead and get started. All right, question 1. The nurse is observing a staff member caring for a client who sustained a traumatic brain injury without cervical spinal injury. The nurse should intervene if the staff member is observed. Option 1, turning the client using the log roll technique to remove soiled linen. Option 2, checking the client's pupils for size in reaction to light. Option 3, monitoring the client's gag and cough reflexes. Option 4, placing the client in the Trendelenburg position. All right, 30 seconds on the clock. Go ahead and drop those answers in the chat. Again, if you guys are just joining us, we are covering neurology questions today. So we have 8 questions we're going to go through. Think about everything related to the brain. We'll cover stroke, Alzheimer's, Parkinson's, traumatic brain injury, and many more. So we're glad to have you guys with us today. And again, be sure and follow us on your favorite channel. We have tons of great live and on-demand content, so we hope you'll follow us, and we're glad to have you with us. All right, our correct answer on this one is going to be option 4, placing the client in the Trendelenburg position. So starting with what this question is asking, we see the word intervene. So when we see the word intervene, we're going to look for the option choice that is the incorrect action. So our correct answer will be the incorrect action to do. So kind of keeping that in the back of our mind, let's kind of talk about appropriate things we should do for a client that has sustained a traumatic brain injury. So we'll talk a little bit about positioning, but some of the basics. We want to avoid extreme flexion or extension of the neck. We want the neck to be in a really, or the head to be in a midline position, head like neutral position, no major like degree changes. We want the head of the bed around 30 to 45 degrees. If our client is too upright, that can cause hypotension. And kind of in opposite of that, what we see in option 4, placing the client in the Trendelenburg position. Trendelenburg is when our head is lower than our feet. So if you think about that, that's not going to be good for a head injury if we're already having a lot of swelling, you know, kind of increased perfusion around our brain, and things are already tight in our skull. We don't want to push more blood that direction. So that's why we want to be at a good neutral 30 to 45 degrees. Putting someone's head down that's not, we're going to intervene. That's not what we want to do. And then again, if we're repositioning these clients, we want to do it slowly. We don't want our head to experience any major changes in pressure. What we see in option 1, this is totally appropriate. A log roll technique is safe for a client with a head injury. On option 2, we're going to use our pupils to be an indicator of brain health. That's part of our Glasgow coma scale. I cannot talk today, I'm so sorry. And then option 3, monitoring the client's gag and cough reflex. Anytime our client has a head injury, we definitely want to make sure that we are maintaining our airway and making sure that there's no risk of aspiration. Good job, you guys. I'm sorry for all my tongue-tiedness. All right, question 2. The nurse is preparing to administer alteplase to a client who's experiencing an ischemic stroke. Which of the following findings would require follow-up prior to administering the medication? Option 1, symptoms started 2 hours ago. Option 2, left total hip replacement 1 year ago. Option 3, blood pressure of 190 over 110. Option 4, right-sided muscle weakness. All right, 30 seconds on the clock. Drop those answers in the chat. And let us know too, this is maybe my favorite question to ask when we do these lives, but if you guys are have just passed your NCLEX, or if you're getting ready to take your NCLEX, let us know. We want to celebrate your big wins or cheer you on along the way. So if you guys have your test date coming up or you just passed, let us know. And I also encourage you guys too, uworldnursing.com is kind of like our landing place for anyone new to the UWorld Nursing community, but we have some great links on there, including our event calendar that you can subscribe to. But we also have a place where you can leave any tips or tricks for the next generation of nursing students getting ready to take their NCLEX. So let it be a way that you can kind of pass along some of the things that worked for you in your studying or helped you on test day. So we hope you guys will check it out. Awesome, awesome. All right, great answers coming in. I will go ahead and pull up our correct answer on this one. So our correct answer on question 2 is going to be option 3, blood pressure of 190/110. So we have a couple things that we'll talk about. So same idea as question 1 where we saw the word intervene. What we see on this one is the word follow up. So again, our correct answer is going to be the incorrect or the alarming, or in this case, the absolute contraindication for giving a medication. So let's kind of talk about Alteplase. It's a very high risk medication, something that we're going to give to a client who's experiencing an ischemic stroke. But Alteplase, you might also hear it be called TPA. It's a thrombolytic medication, so it's going to activate plasminogen to break down or lyse thrombi, which are like our blood clots. When we do this, we're going to be able to have blood perfuse past that blockage, where that blockage was, and restore perfusion, restore oxygenation to any vital organs past that spot. So we can give TPA for things like myocardial infarction and ischemic stroke. But again, whenever we're giving this medication, it's going to indiscriminately lyse or break down clots in our body. So we're going to have a really high risk for hemorrhage with it. So we need to make sure that our client is screened for some absolute contraindications, meaning absolute reasons we should not give this medication. So I'm going to walk through those, and then that'll kind of lead us into our correct answer. But some of these are going to be hemorrhagic stroke. So obviously if we have an active bleed going on anywhere in the body, especially in our brain, we're not going to give TPA. Coagulation disorders, so problems with clotting or with or being too liquid. Recent head trauma, previous intracranial hemorrhage, so again, we're worried about brain bleeds when we give this, or recent major surgery within the last 14 days. And then our last one, uncontrolled hypertension, which is what we see in option 3. So anything over 185/110 typically can cause a brain bleed if we give this medication. So again, we're going to follow up before giving TPA if our client has uncontrolled hypertension. What we see in option 1, symptoms starting 2 hours ago, this is okay. We usually like to give TPA within 4.5 hours, so that the timer starts as soon as the symptoms happen. But we're good in a 2-hour window here. A hip replacement 1 year ago, that is major surgery, but it's been more than the 14 days. And then right-sided muscle weakness, this is an indicator of why we would give this medication, so we're good on that. Right-sided muscle weakness can indicate that we have a stroke going on. Obviously, we want to confirm it's an ischemic stroke before giving it, but nonetheless a reason to give the medication. All right, good work, you guys. Way to go. Okay, question 3. The nurse is caring for a client who had a right-sided stroke. Which of the following complications is the client at risk for developing? Select all that apply. Option 1, aspiration. Option 2, joint contractures. Option 3, impulsive behavior. Option 4, numbness of the feet. Option 5, impaired concept of time. All right, go ahead and drop those answers in the chat. Again, we see the words select all that apply bolded on this question. It'll be bolded on your NCLEX as well. So it's bolded for a reason, to make sure you see it, that you pay attention to it. And so anytime you see select all that apply, do know that you'll have more than one right answer. So be sure you're always marking more than one right answer on a select all that apply. Good job, you guys. I see that we have some NCLEX passers, that's amazing, congratulations. And for anybody that's just joining, we are covering neurology questions, so everything related to the brain. If you guys are new to the UWorld Nursing community, we hope you guys will visit us at uworldnursing.com. We have our event calendar on there of all of our lives that we do on our social media channels, as well as some great kind of initial resources, some good links to help you get started, as well as information on our subscriptions and our free trial. So we hope you'll check it out. All right, good work, you guys. All right, our correct answer on this one, answers are going to be options 1, 2, 3, and 5. So this question's pretty straightforward. We're just looking for, or we're being asked about complications of a right-sided stroke. So it's, instead of there being just one option that we would look for in a single best question, this is essentially everything we would put on our note card to know about complications of a stroke. So let's kind of talk about what happens when we have a stroke on the right side of our brain and how that impacts the left side of our body. So that's kind of just a good frame of reference. Anytime we have a right-sided stroke, it's in terms of muscle, it's going to impact the left side of our body, and then vice versa. A left-sided stroke is going to impact the right side of our body. But knowing that, like, where it kind of crosses is right here, in our throat. So we're always going to be worried about that risk of aspiration for any client that's experiencing a stroke. So whenever we have just kind of talking about a right-sided stroke, the right hemisphere of our brain is typically associated with spatial processing, and it's going to be activated for activities like emotion, art, and music. And so if we have a right-sided stroke, we're more likely to have difficulty with spatial perception, an impaired concept of time, impulsivity, and left-sided hemiplegia, which is kind of what we talked about, where the side impacted is opposite to the side of the brain. So whenever we have any type of hemiplegia, we can be at risk for those joint contractures. So that's really what we see in options 2, 3, and 5. Those are just our general complications associated with right-sided stroke. And we kind of talked about option 1. Anytime, our upper GI tract, essentially like our mouth to our stomach, those are also muscles. So, anytime we have stroke, we have disruption to our brain muscle connection, we're going to worry about that risk of aspiration. So that's a true statement too. What we see, numbness of the feet, a couple things that kind of maybe could be distracting about this one. Numbness, we would think about maybe that's the same idea as like numbness and weakness that can happen with a stroke. But what we see is feet. And so we know that in this case, if we have just a right-sided stroke, the left side of our body, so you would see like numbness of the left foot, and maybe that would be a correct answer. But this is bilateral feet, so that's not going to be a correct answer for this one. What this would typically be associated with would be like peripheral neuropathy, maybe from diabetes, which we know can be a risk factor for stroke down the road. So, but nonetheless, you guys did great. Options 1, 2, 3, and 5. All right, question 4, halfway. The nurse has attended a staff education program about implementing seizure precautions. Which of the following statements by the nurse would require follow-up? Option 1, I should ensure the client has a peripheral venous access device in place. Option 2, I should remove any restrictive clothing or jewelry the client is wearing. Option 3, I will place oxygen and suction equipment in the client's room. Option 4, I will keep tongue blades at the client's bedside. All right, go ahead. 30 seconds on the clock. Drop those answers in the chat. Make sure you guys are talking to Nurse Samantha, who's moderating for us. And let us know, too, if you guys joined yesterday. We did a really great lecture, or Samantha did a great lecture on peripheral artery disease and chronic venous insufficiency. So kind of comparing and contrasting what happens in our arteries that are delivering our oxygen-rich blood and our veins that are bringing blood back to our heart to receive oxygen. So it's a really cool lecture. We hope you guys will check it out. It's available on demand on all of our channels. And again, we're covering neuro questions. I see a lot of new people hopping on, so glad to have you guys with us. All right. Our correct answer on this one is going to be option 4. So again, this question kind of following along with what we see in we've seen in some of the other ones. We see the words would require follow-up. So our correct answer is going to be the incorrect statement or incorrect intervention, something that's not going to be safe for the client. We know that NCLEX is a test all about safety, and so that is something we just want to keep in mind as we're answering these questions. So when we see would require follow-up, let's just talk about general things with seizure precautions. So overall, we want to keep our clients safe, and we want to protect the client's airway. So pretty prioritization kind of strategies 101. But we're going to always want to have the bed rails padded to keep the client's head safe. We're going to make sure that we have an IV in place. We don't ever want to put anything in the client's mouth during a seizure, so we would never want to put a medication in their mouth to help stop the seizure. We need an IV access is preferred, so we can give quick-acting IV medication. We're going to remove anything restrictive that can cause harm or not be safe to the client. And always having oxygen and suction. Again, we always want to make sure we can protect the client's airway and restore oxygen and perfusion as quick as we can when the seizure's over. We don't ever want to put a tongue blade in a client's mouth during a seizure. It can injure the client, become dislodged, break, anything like that. So definitely we don't want to put anything in the client's mouth during a seizure. And as soon as the seizure's over, we will make sure our airway is secured and protected or intervene appropriately. So good job on that one. You guys did great. All right, question 5. The nurse in the emergency department is caring for a client who has slurred speech and left-sided facial droop and weakness. Which of the following actions would be a priority for the nurse to take? Option 1, administer IV dextrose to the client. Option 2, prepare the client for a 12-lead ECG. Option 3, obtain a blood specimen to check the client's serum potassium level. Option 4, transport the client to the radiology department for a CT scan of the head. All right, 30 seconds on the clock. This one is our first priority question, I would say, if I'm remembering correctly, of the day. So think about some of those prioritization strategies, our ABCs. I'll save my comments for when the little answer pops up. So, but you guys are doing great. Good answers. You guys are doing really good. Well done. I'm seeing like 100% accuracy on this one. Y'all are doing awesome. Good job. All right, I will go ahead and pull up our correct answer. Our correct answer on this one is going to be option 4. So again, we see priority. It's bolded for a reason. We want to pick our most correct answer. So what we see in this question, we're seeing, we can kind of put some pieces together that our client might be experiencing a stroke. We know with stroke, time is brain. So we definitely want to identify if a stroke is going on for reasons we've kind of alluded to with some of our other questions. But it's so important that we identify if our client's having a stroke, especially if they're having an ischemic stroke, so we can intervene with TPA and hopefully restore some perfusion to the brain. So again, what happens with a stroke? We have an abrupt alteration in blood flow to our brain. This can be either from a thrombus, which is what we see in an ischemic stroke, or hemorrhage, which is what we see in a hemorrhagic stroke. These strokes typically going to present early on with like headache, facial droop, slurred speech, unilateral weakness or numbness. And one of the first things we can do, kind of seeing based on how our clients presented in the question, is we're going to want to diagnose. We want to make sure that what we're seeing is actually a stroke. So you're going to go and get a CT scan of the head. What we see in option 1, sometimes hypoglycemia can kind of mimic the presenting symptoms of a stroke, so we would definitely want to rule out hypoglycemia, but we're not going to just jump to giving medication until we've checked a blood sugar and we know that's something we need to do. What we see in option 2, definitely something we probably will do, but not anything that we're going to do before we take a CT scan of the head. We definitely want to monitor the heart, but again, we're prioritizing our brain in this scenario. And then option 3, potassium is an important thing to monitor with our heart. We're not as concerned with potassium at this point. We would maybe be more concerned with other electrolytes that might cause more manifestations that would mimic a stroke. But we're worried more when we see potassium, we worry more about dysrhythmias with our heart. You guys did great on that one. Well done. All right, moving along, question 6. The nurse has attended a staff education program about Alzheimer's disease. Which of the following statements by the nurse would require follow-up? Option 1, clients with AD may initially experience difficulty in short-term memory but retain long-term memory. Option 2, the caregiver of a client with AD should be offered referrals for support to reduce caregiver strain. Option 3, physical restraint should be used for clients with AD to manage agitation and confusion. Option 4, a client who has a family member with AD is at higher risk for developing AD. All right, 30 seconds on the clock. Drop those answers in the chat. We also like, as you guys are answering, after you answer, let us know how you guys like to study. Is UWorld part of your NCLEX prep tool belt? Do you like to do practice questions? Do you like to watch lecture videos? Are you using other resources in addition to UWorld? One thing that maybe not everyone knows about UWorld is just the variety of ways we present content. So not only do we have over 2,000 questions in our question bank, but we have hundreds of lecture videos that really walk through everything you need to know about certain disease processes, conditions, medications, pharmacology, all that kind of stuff. So that's new information to you. You know, we're all about presenting content in a way that is easy, breaks down really complicated things to make them as easy as they can be. So we have a lot of cool tools in our platform. So we hope you guys will check it out. All right, very good. I see someone likes lecture videos. Yasmin, I am with you. I like to understand the content first before I did questions. But practice questions are very important. Got to do it all. All right, let's pull up our correct answer. Our correct answer on this one, you guys did great on. This is option 3, physical restraint should be used for clients with AD to manage agitation and confusion. So again, we have to read this question carefully. It says, would require follow-up. So again, our correct answer is the incorrect statement, something we need to teach more, intervene on, make sure it doesn't happen. So when we're talking about Alzheimer's disease, it's a progressive neurocognitive condition. It's going to cause cognitive decline and memory loss. It can also lead to personality changes and an inability to perform self-care. So disruptive behaviors like agitation or aggression, a lot of times that's just a result of an inability to communicate effectively. So maybe that's how a person responds due to like pain or discomfort, hunger, toileting needs, anything like that, or just environmental stressors, any change in their routine, which is what you'll see a lot if an Alzheimer's patient is being needing to be cared for in an acute care setting. Something else besides Alzheimer's brought them into the hospital. You know, they're very out of their routine, a new environment, new people. There can be a lot of agitation, but a rule of thumb, physical restraints are never our first line. That's always our last kind of line of defense or intervention that we're going to take. So before we would use restraints, we would try diversional activities. We would reorient the client the best we can and maintain as much consistency as possible. So having the caregiver be there, following a routine or a schedule, anything like that. So definitely physical restraints are not what we would use to manage agitation and confusion. What we see in option 1, this is a true statement. A lot of times short-term memory goes before long-term memory in clients with Alzheimer's. Caregiver strain is a huge part of Alzheimer's disease. We want to make sure that we're offering resources to the caregiver and to the client themselves, but making sure that in this care team that's taking care of the client, that everyone has what they need to be successful in their role. And then there is a genetic component to Alzheimer's disease, which is what we see in option 4. You guys are doing great. All right, moving on, question 7. The nurse is planning care for a client with Parkinson disease. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. Option 1, discourage the client from consuming snacks between meals. Option 2, remind the client to move slowly when transitioning from a sitting to standing position. Option 3, instruct the client's spouse to remove throw rugs from the home. Option 4, teach the client to use visualization techniques when experiencing freezing episodes. Option 5, encourage the client to take carbidopa, levodopa with high-protein meals. All right, good work, you guys. Drop those answers in the chat. Again, select all that apply. You're going to have more than one right answer. So put more than one answer in the chat. After you guys answer too, let us know what other topics interest you for us to present, or anything you find challenging, anything you want more of. We're always evolving and recreating our content, so let us know what interests you, and we definitely want to hear some of the more challenging things you're learning. If you have a test coming up, you want kind of a deep dive lecture on anything, let us know. We definitely incorporate your feedback into our content calendar. We're here for you. We want to make sure that what we're serving you is what's helpful. So good work, good answers coming in. Good work, you guys. Very good, very good. And I should say this too, if you guys aren't already following us on your favorite platform, please do. We're at UWorld Nursing on all of our channels. We have tons of content that comes through on all of our channels. Live content, on-demand content, nurse life videos. So be sure and check it out. All right, our correct answers on this one are going to be options 2, 3, and 4. So when we're talking about this question, we're really just looking for appropriate interventions, like what we would put in a plan of care if we're writing a care plan for a client. So let's kind of talk about Parkinson's and kind of just like the overarching objectives of our care for Parkinson's. So Parkinson's disease is a progressive neurodegenerative disorder. It's associated with deficient dopamine levels and uncontrolled acetylcholine levels in our brain. So that's kind of how all of these manifestations present themselves, is this kind of unbalance of these neurotransmitters in our brain. So a lot of what we focus on with these clients is safety, obviously preventing fall risk and preventing aspiration as well. So kind of looking at what we're seeing in these options, preventing falls is kind of going to be the name of the game with this question. So clients with Parkinson's can experience hypotension. So any position change, we want to encourage them to do slowly. So we want to make sure from lying to sitting, sitting to standing, that we're doing it slowly, they're taking their time, and there's a support person with them. We want to make sure that we're removing throw rugs. That's like fall risk 101 is no throw rugs. So one of the kind of hallmark manifestations of Parkinson's is that shuffling gait. And so if our feet are shuffling and we come up on a rug, that can get so tangled in our feet and cause a fall. So we want to prevent that. Freezing episodes can also happen. So essentially that connection between our brain and our muscles, something's interfering with it and it's not as consistent. And so by visualizing our foot moving over a box or ourself being in motion, that can kind of re-engage those communication pathways to make sure that our that kind of reactivates our muscles and gets us moving again. So visualization is really helpful for these clients. We definitely, what we see in option 1, we would want to encourage snacks and frequent meals, small frequent meals. We don't want to discourage that. So that's one of the big things. These clients will tire easily from meals, and so we want to offer more frequent, smaller meals throughout the day. And then for carbidopa, levodopa, this is one of the kind of mainstay medications that that a client with Parkinson's will take. And high protein can interfere with the absorption and metabolism of the medication. So we definitely wouldn't want to encourage that. All right, you guys are doing great. Last question. All right. The nurse is preparing to administer Phenytoin to a client with a seizure disorder. The nurse should recognize that adverse effects of Phenytoin include option 1, hypertension, option 2, acute kidney injury, option 3, deep venous thrombosis, option 4, central nervous system depression. All right, 30 seconds on the clock. Drop those answers in the chat. I think I saw someone asking to explain point 4 again. If I'm on Instagram, if I'm remembering correctly, if that was the freezing episode one. Freezing episodes essentially is our muscles just stop moving. So in Parkinson's, that communication from our brain to our muscles can get disrupted. And so by using visualization techniques, it can help re-engage that communication pathway from the brain to the muscle. So instructing a client to visualize lifting their leg and stepping over a box can help get them in motion again. So I hope that's helpful. All right, good luck, you guys. Good work. I see someone saying good luck to Natalia. Good luck, Natalia. If your test is coming up, you're going to do great. Get a good night's sleep if it's tomorrow. All right, we love seeing these answers come through. And again, be sure and follow us before the session's over. We're almost to 50,000 followers on Instagram, so help us get to that awesome milestone. We've reached 50,000 on all of our other channels. So thank you guys for getting us to those cool milestones. All right, well done. All right, our correct answer on this one is going to be option 4, central nervous system depression. So Phenytoin is a medication that we would give to clients with seizure disorders or with a risk of seizures. but it has a very narrow therapeutic index. So typically we're not going to experience central nervous system depression. That would indicate that we're at a not therapeutic level in our body, that there's too much medication circulating in our blood. So it really acts on our central nervous system in a pretty selective fashion to suppress seizures. So whenever we're not at that therapeutic level, we can see things like nystagmus, which is kind of like the back and forth of our eyes. We can also see diplopia, which is double vision, sedation, which we would kind of, you could kind of say like sedation is like in tandem with central nervous system depression, ataxia, which is like a staggering gait, and any type of cognitive impairment. So that would be an adverse effect, not a therapeutic effect, the central nervous system depression. We would worry more in option 1 about hypotension. That would be an adverse effect, not hypertension. We're not really as worried about our kidneys with this medication. And then option 3, we are more worried about bleeding versus clotting. So I hope that was helpful. I hope you guys learned something new about the medication. You guys did awesome on that. As always, thank you guys for joining us today. We hope you'll come back tomorrow at 3 p.m. Central Time. We're going to be doing more questions with Nurse Samantha. And be sure and visit us at uworldnursing.com and follow us on your favorite channel. And we'll see you next time. Bye.